Hi, I'm Matt Willis, Public Health Officer from Marin County, with our COVID-19 response update for April 15th. Yesterday, I started walking through our public online COVID-19 surveillance report. This contains some of the key elements that we track to guide our response and to keep you informed. This is just one of several dashboards we're using in the Emergency Operations Center, where I am now. This kind of information gathering and reporting will be particularly vital to the next chapter of our response. Yesterday, the governor outlined the process for considering potential changes to the statewide shelter-in-place order. And I'm having parallel conversations with regional health officers regarding our shared Bay Area-wide order. We all agree that one of the prerequisites before any changes are made is the ability to closely monitor the impact of any changes we consider, slowly and selectively adjusting shelter-in-place orders. We're confident that this dashboard and other metrics we track daily, or even hourly, will allow us to monitor the effects of any changes in a reliable and timely way. Here's one of the most important elements for tracking. This is called the epidemic curve. Right here, and when we talk about flattening the curve, this is what we're talking about. It shows the daily number of cases of COVID-19 by the date the test was taken. Importantly, the number of tests performed daily in Marin County has increased, and yet we've seen a trend of decreases overall in the number of cases diagnosed. This spike here corresponds to a new strategy where we're sending teams of testers into high-risk settings across the county for early detection and intervention for any outbreaks. This reinforces the point that while we're seeing a general downward trend, despite more testing overall, the virus is still with us and we expect ongoing transmission. This is one of the most important indicators we'll be tracking as we make any potential changes to the shelter-in-place order. Here we have the daily number of people hospitalized with COVID-19 in Marin County, including ICU hospitalizations, and we see a downward trend. Next, we have the number of cases by geography, by region in Marin County. And they're divided into cases for the Novato area, San Rafael, San Anselmo and Fairfax combined, other areas of Central Marin, Southern Marin, and Western Marin. We can only, because of patient confidentiality, report communities that have more than 20,000 people, which explains how we've divided up the county, and only report actual numbers when we have at least 10 cases in any given area. What this shows us is the majority of our cases are along the corridor where most people live, that most communities are impacted, and that more rural West Marin may be relatively spared to this point. Tomorrow, I'll share some of the metrics we're looking at for detecting surges in respiratory illness and how we monitor our hospital capacity in terms of open beds, open ICU beds, and available ventilators. Thank you, stay healthy, and we'll see you tomorrow.